Part 41, Introduction to Infant CPR. Welcome to the lesson on Introduction to Infant CPR. In this video, we will discuss what to do when giving CPR to an infant that is 0 to 12 months of age. Infant CPR. CPR for children and infants is almost identical. Infants more often have a breathing problem than an actual heart problem. It is important to begin CPR immediately. Perform 2 minutes of CPR before going to get additional help. One set of CPR consists of 30 compressions and 2 breaths for one provider, or 15 compressions and 3 breaths for 2 provides. If the infant is unresponsive and not breathing or only gasping for air, perform CPR. An infant that does nothing when you tap or talk loudly is considered unresponsive. In the case of unresponsiveness, CPR needs to be performed. How to provide CPR to an infant. Step 1. Ensure the scene is safe. Step 2. Tap and shout to determine if the infant is unresponsive. Step 3. Yell for help. If a secondary CPR is available to help, have them call 999/EMS and get an AED. Step 4. Check the infant's breathing. If not responding and not breathing or only gasping, then give 2 minutes of 30 compressions and 2 breaths for one provider, or 15 compressions and 2 breaths for 2 providers. Step 5. Call 999/EMS if the second rescuer has not already done so. Step 6. Resume CPR and give compressions and breaths. This concludes our lesson on Introduction to Infant CPR. Next we will review chest compressions in infant CPR.